Want to score over 850 in your MedSurg exam? Then let's get started. Today we'll cover 10 questions on critical thinking. Question 1. A client with a history of peptic ulcer disease is prescribed ranitidine. Which dietary instruction should a nurse provide to the client? Take the medication with antacids, avoid caffeine while on this medication, increase your intake of spicy foods, stop the medication if you experience diarrhea. Pause the video and select your answer. If you chose option B, you are correct. Avoid caffeine while on this medication. Caffeine can increase gastric acid secretion and exacerbate symptoms of peptic ulcer disease. Clients should be advised to avoid caffeine containing beverages and foods while taking ranitidine. Question 2. A client with heart failure is receiving Lasix to manage fluid overload. Which assessment finding indicates a need for immediate intervention? Urine output of 50 ml per hour, crackles auscultated in the lungs, serum potassium level of 3.8, blood pressure of 90 over 60. Pause the video and select your answer. If you chose option D, you are correct. Blood pressure of 90 over 60. Hypotension can be a side effect of furosemide, especially when administered intravenously. In a client with heart failure, hypotension can exacerbate cardiac output and tissue perfusion issues. Therefore, a blood pressure of 90 over 60 requires immediate intervention to prevent further deterioration. Question 3. A client with a history of DVT is receiving enoxaparin subcutaneously. Which instruction should a nurse provide to the client regarding self administration? Inject the medication into the muscle, massage the injection site after administration, apply pressure to the injection site for 10 seconds after injecting, avoid rotating injection sites. Pause the video and select your answer. If you chose option C, you are correct. Apply pressure to the injection site for 10 seconds after injecting. Applying pressure to the injection site for 10 seconds after administering enoxaparin helps minimize the risk of bleeding and bruising at the injection site. Question 4. A client with septic shock is receiving norepinephrine infusion to maintain blood pressure. Which assessment finding indicates a therapeutic response to the medication? Blood pressure of 90 over 60, heart rate of 120 beats per minute, cap refill time of 5 seconds, map of 65. Pause the video and select your answer. If you chose option D, you are correct. Mean arterial pressure of 65. Norepinephrine is a vasopressor used to increase blood pressure in patients with shock. A mean arterial pressure of 65 indicates adequate tissue perfusion and a therapeutic response to the medication in this context. Question 5. A client with cirrhosis is admitted with ascites. Which dietary restriction should a nurse include in the plan of care? Low protein diet, low fat diet, low sodium diet, low carbohydrate diet. Pause the video and select your answer. If you chose option C, you are correct. Low sodium diet. Ascites is the accumulation of fluid in the peritoneal cavity, often associated with liver cirrhosis. Restricting sodium intake helps reduce fluid retention and minimizes ascites formation. Question 6. A client is scheduled for a cardiac catheterization. Which nursing action is a priority in the pre-procedure phase? Administering pre-medication for anxiety, verifying informed consent, starting an IV, monitoring the client's vital signs. Pause the video and select your answer. If you chose option B, you are correct. Verifying informed consent. Ensuring that the client has providing informed consent for the cardiac catheterization procedure is a legal but ethical priority before any invasive procedure. Question 7. A client with acute pancreatitis is experiencing severe abdominal pain. Which medication should a nurse anticipate administering? Acetaminophen, ibuprofen, morphine sulfate, hydrocodone acetaminophen. Pause the video and select your answer. If you chose option C, you are correct. Morphine sulfate. Morphine sulfate is the drug of choice for managing severe pain associated with acute pancreatitis due to its potent analgesic effects. Question 8. A client with chronic obstructive pulmonary disease is prescribed oxygen therapy. Which assessment finding indicates effective oxygenation? Oxygen saturation of 85%, respiratory rate of 10 breaths per minute, PaO2 of 55, decreased dyspnea on exertion. Pause the video and select your answer. If you chose option D, you are correct. Decreased dyspnea on exertion. Decreased dyspnea on exertion indicates improved oxygenation and respiratory status in a client receiving oxygen therapy for COPD. Question 9. A client with a history of atrial fibrillation is prescribed warfarin therapy. Which laboratory test should a nurse monitor to assess the client's response to the medication? Prothrombin time, activated partial thromboplastin time, platelet count, international normalized ratio. Pause the video and select your answer. If you chose option D, you are correct. International normalized ratio. The INR is used to monitor and adjust warfarin therapy to maintain the desired level of anticoagulation and reduce the risk of thromboembolic events in clients with AFib. Question 10. A client with a history of diabetes mellitus type 2 is prescribed metformin. Which laboratory test should a nurse monitor to assess for a potential adverse effect of the medication? Serum creatinine, serum potassium, liver function tests, serum glucose. Pause the video and select your answer. If you chose option A, you are correct. Serum creatinine. Metformin can cause renal impairment, particularly in clients with pre existing renal dysfunction. Monitoring serum creatinine levels helps assess renal function and detect potential adverse effects of metformin on the kidneys. Click that subscribe button and join us next Monday.